I'm Nick Vogelzang. I'm a medical oncologist specializing in chemotherapy, and I've been involved in treating mesothelioma patients for almost 30 years now. So the usual patient with mesothelioma has symptoms when you ask them going back 3 to 6 months. It's not uncommon for a patient to have had shortness of breath or chest pain in retrospect that has bothered them and they've gone to a doctor once or twice. It's very hard to say that there's anything wrong with that because this is a very rare disease. The average doctor will see 1 or 2 cases in his or her lifetime. So you cannot expect the doctor to make this diagnosis quickly. When you get to a mesothelioma expert, someone who's treated hundreds and hundreds of these patients, we see patterns. And the pattern is that the patients who wait the longest tend to have the heaviest amount of cancer. My experience with mesothelioma now is almost 30 years. And at one point I was seeing between 30 and 50 patients a year. Fortunately, we're seeing a decrease in the frequency of mesothelioma in the United States. We hope as a result of asbestos being less used. But I probably have seen 400 to 500, maybe close to 1,000 patients. The person who gets mesothelioma is the same person as you would see on the street. They range from school teachers to baseball players to iron workers to construction workers. I have seen architects, lawyers, physicians. It does not respect gender or race or occupation. That having been said, more men than women are likely to get it, and the elderly are more likely to get it than the young. As I said, the average age is 63 to 65. The age of diagnosis in the United States has been going up, but in Egypt, where they have exposure to asbestos at a very young age, they're seeing people in their teens. So it depends upon where you live and what your risk factors are. Mesothelioma is like most common cancers. It starts in one organ and generally stays there unless you can get it out. But if you cannot get it out, mesothelioma can spread throughout the body, often to the other lung, often to the lymph nodes in the center of the chest, or to the bone. I've seen it go to the lymph nodes in the neck. I've seen it go to the liver, to the brain, and other places. But those are usually when the cancer in the chest has advanced to a very large extent.